I want to go back on the table.
That's what we get a lot of them work with. We call cooperative care, which is getting them used to all the body handling and getting shots and just, having their ears touched. And one of the first things we teach them is just willingly jumping off and on the table so that they're not making them get up. So they come in, when they come in for their just little appointment, half-hour appointments to work on it, they come in and we have a little object comes in, unless they're going to leave. She comes in and she just hops on the table and she's like, okay, let's go. She's ready.
Right. Yeah, he's used to being patient because she cleans his wrinkles and everything, and he just sits there.
It's great. So you be a good boy. We'll see you back next week, okay? Won't be quite as much fun for you next week, but you would seem nice to have. Say we'll dote on you and feel all sorry for you and everything next week.
So it's gonna be a lot of pain.
No, we give him, so he'll get pain medication. So we give him an injection. Some of the sedative medicine we give him has pain, component for pain, and then he'll get an injection at surgery. Before we do the surgery, we actually do a sort of like they use for your teeth and numb when they do something on the surface. So we inject some of that into where we're going to do the incision and actually into the testicle with the one that's there that we can feel. So it numbs all that. So there's a lot of stuff that goes in for pain management before we even do surgery, and then he gets stuff afterwards, and he'll go home with pain meds.
Oh.
And then we also do a laser. We have what's called a therapy laser that uses light therapy that we do afterwards, a treatment, and it helps it heal faster and decreases pain and stuff. So,
But when after done, it's gonna be covered, right?
That will not be covered. His incision will be, the one incision will be right in front of the scrotum. It'll be like that to take out the testicle that's there that we can see. Hopefully the other one that's on its right side will be about the same length. And hopefully if it's right where I think it is, it's going to be just an angled incision kind of right next to it like that.
So is he got stitches or is it kind of...
They'll be all inside.
Oh, okay.
Usually they're all buried underneath.
Right.
If we have to go into his abdomen, that's going to be a little different because then we're going to have to open up his belly.
I hope
and
not.
you're going to have stitches right along. Yeah.
So the small incisions you're making through the skin, is that going to be super glued or is it going to be...
It'll be,
stitched?
we do, there's usually 2 layers underneath and then glue on the surface.
Okay.
So,
Bacon, come on.
and those are absorbable sutures. So.
Right.
Yeah.
So he'll be groggy for the whole day, pretty much.
Probably, but they usually come out, pretty awake, but usually they'll go home and kind of rest the rest of the day.
Right. Okay.
And then keeping him quiet, because, we try and do really good pain control and keep the swelling down and all that kind of stuff. So sometimes the biggest problem is actually keeping him quiet for the next week so that he isn't overactive to where then that can cause swelling and stuff. Because they're moving around too much, and then they get seromas and things that, where they build up fluid around the incisions because they're moving around too much. So sometimes the hardest part is keeping them quiet.
Right.
So.
Yeah, usually we don't have issues with him. When we take him for walks, he knows, and he's like, like I said, the only time he gets really excited is like barking at that ball.
Yeah.
Other than that, he's like just happy to see everybody.
Yeah.
So,
No, sometimes he likes a rough play.
well, yeah,
That's why his
He'll
eyes just come
roughhouse
up.
with me.
Yeah,
I'll lay down on his bed and we'll roughhouse. But
yeah.
You ready to go home?
Ready, Bacon?
Like I've been sitting at the door a little.
Tuesday, remind me. No, Monday, right?
Tuesday, not Monday.
No, the 10 p.m. is gonna be
Yes,
Monday.
Monday night,
Monday.
yes.
Yeah.
Before we start. And then you gotta have the willpower to not give in to the eyes. The sad eyes.
Oh, yeah.
Of where's my food? You forgot my breakfast.
Yeah.
So I need to,
Willpower.
yeah,
So make sure there's no food in this bowl either, okay?
yeah, just water.
Yeah, and then, because we
Well, we
have,
don't want him to drink a lot either.
right,
Because if
Just-
he's got a lot of water, he can vomit. When
Right.
he's going under anesthesia, they can aspirate, so.
Again,
we won't, we'll use this small bowl for water
yeah,
after 10 p.m.,
yeah.
okay? That way we can limit his drinking.
Maybe you should have your own Facebook page.
He does.
He does. He does.
Okay, what's it under?
It's under Desi Harden.
He's on YouTube too.
And it's on YouTube as well, yeah. I think I got a video with that ball.
Megan.